Good evening, everyone. I am Dr. Tivon Browne, and welcome to another riveting episode of Health Talk, sponsored by the Renal Society and Von Radio. Now, today, I want to touch on a topic that has been concerning me over the past couple of weeks since our last talk, and that's hypertension. But before we get into that, someone from the Renal Society will call in later tonight to announce the results of their general election that they had today. Another thing I want to touch on, I want to, make a special shout out to the kids of the Youth Health Career Mentorship Program that completed the program today with a big health screening at the Cotton Ginnery Mall. These kids, they spent the last 2 weeks of their vacation learning how to take blood pressure, learning about the different careers in health, also learning how to take blood sugar, weight, height, BMI, all the health values we as clinicians use to assess patients. And these are valuable skills that they learned, and they got a lot of insight onto the jobs that they want, something that they might not even know about and learned through this camp. So I want to congratulate all the participants, and I would say thank you to the parents, the grandparents, the guardians, everyone who helped make this program happen, and everyone who helped steer some young person in the direction of that program. Now, hypertension relates to kidneys in a big way, in that the kidneys are one of the main organs in the body responsible for maintaining blood pressure. Over the last few weeks, I would say 2 or 3 weeks, I realized, in the different areas that I service, a lot of people have been coming in with abnormal, highly, blood pressure readings. And I find that a lot of these people who come in, they usually don't have any symptoms at all, which, highlights that, the name that we give hypertension, the silent killer. It's really silent, really no symptoms for years, and unless you check your blood pressure regularly, you would never notice until the condition is further off than is necessary for treatment and reversal even. So hypertension, what I want to get into today. Hypertension is just abnormally high blood pressure. Normal blood pressure, sometimes we say, depending on where you studied or where you live, some say 120/80, that or less. Some others, based on the areas that we live in, like here in Latin America and the Caribbean, we take the Pan American Health Organization recommendation for blood pressure readings as 130/80. If you see a reading like that above 130/80, maybe you need to do a recheck, maybe you need to check your pressure more regularly, consult your physician. Now, with hypertension, or high blood pressure as we call it, 90% of the cause is unknown. For some reason, the patient just develops high blood pressure. We have no idea why. Sometimes we can't find a cause. Most of the times we can't find a cause, 9 times out of 10. And that alone is another indication that we should check our blood pressure more regularly, because we can't chalk it up to family history of some illness, or it's in my family so I can get it, or if it's not in my family so I can't get it. We can't say that. 90% of the cause is unknown, and the only way to figure it out sometimes is to just check your pressure regularly, especially if there's a scenario where there's no symptoms. Now, with the 10% that is attributed to a cause, you have things like kidney disease, certain medications, stress, pain, and difficult thoughts, difficult processes that kind of can raise blood pressure to a certain level. And more often than not, these causes, they can be rectified, treated, calmed down. With most blood pressure cases, the aim for me, especially as a clinician, is to try and get it down as naturally as possible. Things we try to advise patients to do is to reduce the salt in their diet, reduce the sugar in the diet, the carbohydrates in their diet, lead a less stressful life. Any stress you could identify in your life, you want to kind of tone it down or do something that could either remove the stress or you remove yourself from the stressful situation. Other things is get more exercise. Exercise helps the body regulate blood pressure even more and better. Sometimes hydration is also very important. Checking your blood count can also be important in maintaining your blood pressure. And just small changes like these are what I usually want to start off with to see if my patients can maintain a good blood pressure just by making these lifestyle changes. And more often than not, these changes help these patients reduce their blood pressure by significant amounts, and not only improving their pressure but also improving their lifestyle, their mental health, overall feeling better once you make these positive changes. Unfortunately, that's not the case 100% of the time. Sometimes patients need 1, 2, 3, sometimes 4 and more medications to manage their pressure. I know that's a huge thing with a lot of people taking medication to regulate the systems, or taking multiple medications are even more difficult tasks. But sometimes it really is necessary, and we as doctors, we don't try and give people medication unnecessarily, because medications themselves, they have side effects. You change one thing in the body and another part of the body responds. So we try and take all things into consideration before and when putting patients on medication. Whenever a doctor makes a recommendation, it's usually for the better, and it's important that the patients work along with the doctor, because a patient-doctor interaction is a teamwork. Any kind of interaction with the healthcare system is a teamwork. Doctors can't tell you what to do, nobody can force you what to do, and we can't force patients can't force us. We work as a team together to try and make the patient's life better. And that's how I like to look at it as well. It's always a teamwork. So I must make the recommendations to you and explain to you as best as I can in a way that you can understand what I'm trying to say or what I'm trying to do. And you communicate with me your approval or your disapproval of my recommendations, and together we could work out something in between, something that would work well for you. Sometimes a person might not want to be taking multiple medications, so we could always make recommendations for medications that come two medications in one tablet. That would help a lot in reducing the amount of medication taken by any one person, and you still get the desired effect. So if that's the issue, we could always talk about it and get to a point where it works for both of us. Now, most of these medications, the most effective ones, target the kidneys, which is the whole reason we're here tonight and every third Thursday. The kidneys, they control blood pressure in the body, among other things. But that's why most of the most effective medications, they target the kidney, any process within the kidney that causes blood pressure to raise or fall. So most of these medications targeting the kidney rely sometimes on a kidney's good functioning, and also a bunch of other different factors. Some work better in others, some don't work well in others, and we usually go to second line medications targeting blood vessels, medications targeting the heart, or just medication targeting the fluid flowing in the body. All help reduce blood pressure. Now, uncontrolled blood pressure is one of the most dangerous things that you can be walking around with health-wise. Uncontrolled blood pressure can lead to things like heart attacks, stroke, paresis, which is dysfunction in one or both sides of the face, our body. It's a lot of different health effects that come with hypertension, and if you develop a stroke or a heart attack or any other defect caused by hypertension, some of these things are irreversible or only partly reversible, and you may end up living with a condition that will make your life even more difficult than just taking 1 or 2 tablets a day. So it's really important to get a handle on high blood pressure. It's always good to get your pressure checked regularly. I would say for those who don't suffer from hypertension as often as you can. For those that do, you want to get your pressure checked every day, and you also want to be consistent with whatever medication regimen you're on, or if lifestyle changes are what were recommended to you, you could make those and should, maintain life. Nothing is perfect, nobody is perfect. Sometimes you may forget to take your medication, sometimes you may not want to take your medication, but with practice and with diligence, everything gets easier. And if you make it a part of your routine, then your life will be a lot better going that way. Getting exercise regularly, eating food that are low in salts, low in the salt-based seasoning, that goes a long way when it comes to blood pressure. If you do have hypertension, it's important that you see your doctor regularly enough. You check your pressure regularly enough, do your blood work, and make sure that you kind of stay in touch with your doctor, because things could change. Something in your life, a stressful event, or a season like Christmas, for example, where we eat a lot of salt-rich food, season-rich food, and your pressure may rise a little bit more normal than you expect. And depending on how much this may rise, if you check your blood pressure on a regular basis, you could make the necessary adjustments. Say maybe eat less of that food, or even do a little bit more exercise to kind of regulate for the change that you might have experienced. But if you don't check and if you don't follow up with your doctor, then you may be in a situation with the silent killer stalking you. Alright? So blood pressure and kidneys, two important things. It's important to take your medication. We highlighted and emphasized all of this. And kidneys, really strong basis for blood pressure. It's really important. Like the kids today, they were screening blood pressure, and most of the values came out good. Some persons, we had to give some advice to them, and for the longest, or this past couple of weeks, as I said before, I've just been coming across a lot of people with a lot of extremely high blood pressures, and they don't know, they never experienced a pressure that high before. It might have been high once, and it never got that high again until this moment. And I find it a little bit scary to find these kind of cases, and some people's blood pressures, they're really high, and I even wonder, how could you be walking around with pressure like that and not feel anything? Like, my pressure goes up a little bit and I could feel it. I know I get a little throbbing headache, and somebody's pressure is way higher than anyone that would cause that effect on me, and they find it normal. The body has adjusted to that high pressure, but that adjustment could only last for so long. It's tough, and from a public health perspective, these increasing cases, that can be seen as a good thing, because that means more people are interacting with the healthcare professionals, more people are being found through screening, checking, and the more people that are found, then the more treatment we, doctors, clinicians, dietitians, could offer patients to create a healthier society. And that's the aim of public health. We screen the population, we want everybody to get checked, and we want everybody to be healthy. A healthy nation is a wealthy nation, and I strongly believe that the healthier workers we have, the better off we are as a country as a whole. And it has to start one by one, but we need to make blanket decisions, blanket movements to try and get everybody on the same level, as close to the same level as possible when it comes to health. More healthy programs, more healthy movements. We're big, heavy on walking kind of country. A lot of people walk a lot here, mornings, afternoons, and nights. So we need to get back into that as well. Walking groups, exercise groups, healthy cooking, community demonstrations, community gardens even. These are things that we should be emphasizing on these days, especially with the turmoil going on in the world. If we could be more self-sustaining, grow our own food, kind of maintain our health as a population, and fixate more on building together, building with each other, then we'd all be in a better off position. But we got to start one by one. So again, I want to emphasize, everyone, get your pressure checked at least, I would say, once a month if you don't have a problem, more if you already have been diagnosed or have had an abnormal blood pressure reading. It's important to do at least one set of blood work every year, so at least you could get a baseline with your doctor, and going forward, if anything changes, then it would be easier to pick up than if you just come in for the first time randomly and we don't know if this is your normal or if it's something abnormal. So a good history with your doctor is very important, and it helps a lot in terms of management and care. So now we're just waiting on somebody from the Renal Society to call in and give us the updates on the election they had today. But in the meantime, while we wait on the call, a lot of folks always ask me, what is the best natural thing to take to reduce blood pressure? Because as a natural earth-based population, a lot of us like to use the natural things, the herbs, which is a part of lifestyle as well. And in research, because I always want to look at the research and see what really works and how to best guide patients, I always found in research that garlic does have an effect on blood pressure. It decreases blood pressure. 3 milligrams of garlic can reduce your blood pressure by at least 10 points. That might be significant for someone who is in the category of pre-hypertensive, meaning not yet above the 130/80, but close. So garlic reducing your blood pressure 10 points, but the 3 grams, that's the recommended amount. I guess you gotta cut it up and measure it with a scale to get that appropriate amount of the 3 grams. Another good thing for blood pressure that I found in the research is actually what they call the hibiscus tea, the flowers to be exact. Those have a positive effect on blood pressure. It reduces blood pressure by another at least 10 points. I'm not sure about the dosage, but that tea has been recommended to reduce blood pressure, and the research has confirmed that it helps a lot. So garlic and hibiscus tea, 2 good things to reduce your blood pressure. Other things, you put that with the exercise, you put that with regular taking of medication and reducing salt in the diet. That goes a long way. Medications that have been known to raise blood pressure now are things that you should kind of talk to your doctor about and ask if you have hypertension or if you have pre-hypertension. These medications are some of the medications you want to kind of talk to your doctor about. Maybe they could reduce or change it to something different. You could kind of get a new medication in the mix as well. What we call painkillers, that we call the NSAIDs, things like ibuprofen, naproxen, Voltaren. They have a slight effect in raising blood pressure. Steroids like prednisolone, these kind of medications also raise blood pressure by a good bit. Alcohol, another big one, raises blood pressure a lot. Sometimes it's kind of hard to give up on that one, but if you suffer from hypertension, you might want to consider cutting back to as few or no drinks as possible. Alcohol does have a effect in raising blood pressure, so cutting away from that would help a lot. Salt, we already know, raises blood pressure. Other people ask about ginger tea, and they say ginger tea helps a lot, but I haven't seen anything in the research that talks about ginger tea. Some mix garlic with ginger tea, and they say that helps a lot, but I think the effect is more on the garlic side. Neem is one thing known to thin blood, and I guess in thinning this blood, it kind of brings down the pressure. by a good amount. So some neem would help, but I would take that under advisement, as neem, known to thin the blood, may cause, some bleeding episodes in others who already have, bleeding issues or clotting factor issues. So you might want to talk to your doctor about any kind of natural remedy you use. Even though it's a natural remedy, it's still medicine and it still has an effect on the body. So it's important to always get professional advice before trying anything new, anything kind of unheard of. Okay. So I guess we're still waiting on those election results. Nothing yet from anyone. Maybe they're still counting the votes, I think. Okay, so we know the Renal Society been a foundation here in Nevis for a long time. They sponsor shows like this, education programs like this. Last month they did a big health screening for the kidney month, and upcoming, I know for sure they have the walk, which is always exciting, the annual Renal Society walk. Last year, was one. It was the first time I joined the walk personally. I love walking and I love running, so that was a good one for me. They went up to Zetlands, up to Rollins, came down and ended at the Heritage Village, which is a good walk. I think it reminds me of when I was in Gingerland High School. Sometimes the school bus wouldn't come and we had to walk from Gingerland all the way to Butler's, hoping to get a lift, but sometimes we did, sometimes we didn't. So walking has always been a big part of my life. I love the walks, so look out for that one, the upcoming Renal Society walk. The t-shirts will be on sale. I'm excited to see this year's design and colors. Other things we have coming up: health screenings, always important. Look out for the screenings so you could get your health check for free. And usually at the screenings we have doctors who are willing to give advice to anybody who needs it. And another upcoming event for the Renal Society is the gala, the appreciation gala for all the sponsors and all the members who we provide care for. Donations are always welcome. Last year's gala was great. I wouldn't miss this one for the world. Those are some of the upcoming events for the Renal Society. No call for the night, so I think we're gonna just call it a night tonight. All right, so thanks again everyone for listening. Thanks for paying attention. Any queries you have, you find me in the street, you find me at the health center, you find me at the hospital, you just give me a call. Feel free to come up to me and ask for any advice. Always remember to check in with your doctor regularly, especially if you have a condition. If you don't have a condition, always check your vitals regularly. You don't want to get stalked by the silent killer, high blood pressure. So please, I can't stress it enough. We've been having a lot of cases of people with silent hypertension, no symptoms. They just come, have abnormal readings. So if something is bothering you, if you feel a weird symptom, a headache, chest pain or anything like that, please contact a medical professional as soon as you can. If not, and you haven't checked your pressure in a while, it might be a good time to check again, okay? And that has been my health talk for the evening. Thanks for listening, everyone. Good night.
You were just listening to Health Talk, sponsored by the Nevis Renal Society in collaboration with Von